Okay, let's talk about what TMJ disorder means. When people call, they often say, I have TMJ. What they really mean is I have TMJ disorder, popping, clicking in the joints, pain, head pain, neck pain, etc. This is all very, very common when the disc that covers the jawbone is out of place. First of all, let's talk a little bit about the kind of calls I get at the office. My team reports to me that frequently the dentist will give them a night guard, and it's often made of soft, rubbery material. Often it kind of looks like this. I'm not sure if I got that on the screen quite right, but it looks soft and rubbery. With that in your mouth, you're actually going to grind and clench your teeth even more because it's like having bubble gum in your mouth. The kind of night guard that most dentists make is going to be like this. It fits on the upper teeth. We don't do those because there's several reasons why. You cannot get your tongue to the roof of the mouth where it belongs for good nasal breathing, which is critical to good health. This rock solid device, which I can't even get off the model, is so solid it locks up the cranial bones from the motion that they're supposed to do every day. Internally, your brain moves and pumps blood. This slows that down, which is not good for good health. So there's another issue with wearing this upper device. It does indeed protect your teeth. However, it does not get to the root of the problem. You really need that analyzed properly to understand why you might be wearing a night guard. Maybe you need an MRI of the jaw joints. Maybe the cranial bones are distorted so things are out of balance. Another issue with wearing night guards, folks, is that night guards are for nighttime use only, which we don't usually recommend until you're done with treatment and you position the joints, the discs look good, the jaws look good. Basically, there's a problem that's going on all day and all night. So in my practice, we tell folks, look, if you're going to wear a guard of some kind, usually it has to cover the lower teeth, and you must wear it day and night because that's when the discs are slipped, both day and night, not just at nighttime. So if you wear a night guard, then the next morning you take the device out of your mouth, go have a bagel for breakfast, well, that jawbone is going to go banging right in the socket and may crimp up the disc and damage it further. And that's a disc that's already out of place as it is. So here you have a disc that you bang right into. It's just going to hurt you even further. What we usually recommend is if you're going to need a bite guard, do it the right way and put it on the lower teeth. Full coverage across all the teeth to protect all your teeth from clenching and grinding. It has to be done in a special way though, so that one side of the appliance may be taller than the other side to compensate for the cranial bones being distorted. In other words, if your jaw bones are like this, you need more thickness to the guard on this side than on this side. So in almost every single night guard that I make, one side is taller than the other to compensate for any distortions. Then you have to secondarily make sure the jawbone itself is in the right place in the socket. So if you're doing that kind of work, you need to be very careful about the positioning of the night guard itself. At the end of the day, you're wearing a bite guard to protect your teeth, and that's all it really does for nighttime use. You really need to analyze the whole picture and figure out what is really going on. Why am I grinding? Why am I clenching? Another reason that people tend to clench and grind their teeth is to stimulate the dilatory muscles of the airway, i.e. these muscles are stimulated when you clench and grind, which helps you open the airway. So grinding and clenching may be a serious indicator that you have an airway, i.e. a breathing issue. You might even have sleep apnea. These are the kind of things we want to look at and see, is that a possibility? A lot of my new patients, we order sleep studies to figure out what is really going on here, and let's see if it ties into the grinding. Are you clenching and grinding to stimulate those muscles to open your airway? Again, another thing that needs to be looked at. This is why I don't recommend simply wearing just a night guard. It does not do anything but protect the teeth, and it does not get down into the root of the issues. Thank you.